Joining our conversation, Dr. Ashish Jha, Dean of Brown University School of Public Health, one of our favorite people to pepper with all of our questions about where we're heading. But I wonder if you can put into context this moment, which is just the ultimate whiplash, this unimaginable death toll. I remember when the White House, at one of the few briefings where they did have some numbers and briefings, I remember Deborah Birx and Donald Trump in the Rose Garden saying 100,000 people might die. And I gulped. I couldn't process that. We're at 500,000. But we have reason to be hopeful that the vaccines will put an end to this.
Yeah. So, Nicole, thanks for having me on. I think unimaginable is exactly the right word. I don't think I could have imagined a year ago that we would be at 500,000. This has been a catastrophic failure, probably one of the biggest failures in American history. As we reflect on this moment, I think there are a couple of things. I think it's really important to mark this moment, to honor all those people who have been lost, but also to redouble our efforts and our resolve to save as many lives as possible going forward. I am very hopeful about the months ahead. But we're not out of this completely yet. And the next couple of months will still be tough. And then I think as we get into later spring and summer, I think things will be meaningfully better.
What is the lasting impact to our standing in the world to be the country that did the worst, to be the country that didn't believe in the science of masks, to be the country that didn't adhere to the few things we could do to protect ourselves? What's the lasting stain of that?
It's going to take a long time for us to rebuild our credibility. I mean, for years, we would go to countries and say, here's how you should manage this. Here's how you manage this disease. Here's how you manage this outbreak. Countries like Vietnam that have done extraordinarily well, or large numbers of countries across the African continent, across South Asia, are going to be pretty skeptical of the advice we have to give. And I think we really have to rethink our standing. And then, of course, the fact that in the middle of this horrible crisis, we walked away. We walked away from WHO. We walked away from our commitments to global vaccinations. All of that combined really has put us in a very different place than I think we've been in a half century. And it's going to take years to rebuild.
Where do you see the vaccine rollout in terms of the hope that it's going to intersect with that line of the variants coming here and spreading the way they did in the UK, and the possibility that we may need to adjust them or adapt them as those variants take hold if they do?
Yeah, I'm pretty hopeful. I mean, obviously, this past week was tough because of all the storms and what happened in Texas. So we saw a drop off in vaccinations. I think we're going to see a big pickup this week. I think we'll have days when we're above 2 million vaccinations a day. And I'm very hopeful about March. And that means I think that before the variants become dominant, I think a vast majority of high-risk people will have gotten at least one dose. And so I'm hopeful about this. Obviously, there are things we could speed it up. We could try to get more first doses into people. But, the bottom line is I think we're on a good track. And fingers crossed that the UK variant ends up not being that much of a problem for us. In terms of updating vaccines, that's possible. I think that if we see variants that really are resistant to our vaccines, we may need to do that. I don't see evidence that we need to do that right now, but it's certainly something we have to keep a close eye on for the future.
There's so much coverage now about the mental health toll that the isolation has taken and the education inequities of remote learning for folks that aren't in a household where someone can stay home all day and basically serve as an IT supervisor and help academically. What do you think the big policy conversations are as we begin to come out of this?
Yeah, there are several, right? I mean, one is we really have to make a concerted effort to get kids back to school. And one of the many frustrating things about this pandemic is we've set up yet another false dichotomy between teachers' health and kids' school, right? And the question is, which one do you want to choose? I don't want to choose either one. I actually want teachers to be safe, teachers and staff. I think it's critical for long-term success of schools. And I think we now have evidence about what we need to do. So I think that is one area where I want to see Republicans and Democrats, liberals and conservatives come together and work together to make schools safe for everybody to get back. On the broader mental health issues, my gosh, this is going to be one of the many, but one of the largest fallouts of this horribly mismanaged pandemic. We're going to put a lot of attention, energy, resources into dealing with the mental health fallout. It's very substantial for kids as well as adults.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.